Throughout a woman's life, health issues like pregnancy and pregnancy prevention with the use of birth control and menopause can increase the risk of developing high blood pressure. Nearly half of American adults have high blood pressure, and many of them don't even know they have it. That's why hypertension is known as the silent killer. Most of the time, there are no obvious symptoms. But when left untreated, the damage that high blood pressure does to your circulatory system is a significant contributing factor to heart attack, stroke, and other health threats. I now would like to introduce to you Dr. Justin Dunn. He's president of the American Heart Association Board for Akron and Portage counties, and he's also the lead of our blood pressure pillar. Dr. Dunn?
Thank you, Shri, and welcome everyone. Again, my name is Justin Dunn. I'd like to speak to you a little bit about the American Heart Association's work with blood pressure, hypertension. So let me start by introducing the other members of our pillar team, starting with Amanda Wage, co-vice president of Brennan, Manna, and Diamond. Dr. Jeffrey Hallam, professor and associate dean for research and graduate studies at Kent State University. Brian Adams, Director of Ambulatory Services at UH Portage Medical Center. Dr. Anjan Gupta, Director of the Cath Lab at University Hospitals Portage Medical Center. And Kevin Rushing, Director of the Bursar's Office at the University of Akron. So why is blood pressure important? Arguably, no single risk factor has more impact on the nation's death rates from cardiovascular disease than blood pressure. It's the second most preventable cause of heart disease and stroke deaths, only second to smoking. So many of our pillar committee members deal with hypertension every day as part of their jobs and see the effects it has on the community. We're constantly amazed by the number of people with high blood pressure. And the numbers that we've shown here of people with diagnosed high blood pressure are relatively small in comparison to the number of people who actually have high blood pressure and don't know about it. Prevalence of blood pressure, high blood pressure is very high, and awareness is very low in our community especially. So what are we doing around blood pressure currently? So with the American Heart Association, Summa Health's Check Change Control Program, in local barber and beauty shops and faith-based organizations helps identify hypertension in higher risk communities. Target BP is a national initiative with the American Heart Association in response to the high prevalence of uncontrolled blood pressure. Target BP helps healthcare organizations and care teams at no cost to improve blood pressure control rates through an evidence-based quality improvement program and recognizes these organizations that are committed to improving BP control. It essentially gives them a roadmap to success. We also have the development of self-monitoring blood pressure and telehealth. Now, what are some ideas of how companies can get involved in helping blood pressure in our community, helping treat blood pressure in our community and identifying blood pressure? We need help to make some of these following ideas come to life. And as we share these ideas that our team came up with, feel free to share any ideas that you have in the chat box. Implement non-traditional blood pressure education and screenings. Expanding our Check Change Control Program. Education through our faith-based organizations, as well as screening. Creating turnkey programs for HR departments at local businesses. Community conversation series. And use traditional and non-traditional media outlets to spread awareness and education. Now, if this pillar resonates with you, please put the word blood pressure in the chat box. Thank you everyone for your time. Back to you, Shri.
Thanks, Dr. Dunn.